Hey there, deep divers. Are you ready for this? Today, we're going deep on AI. Specifically, we're going to be looking at the potential of ChatGPT in cardiac surgery. You know, that thing everyone's talking about.
Yeah, seems like it's everywhere these days. But for this deep dive, we'll be focusing on a narrative review from the Journal of Cardiothoracic Surgery.
And the title's a real grabber, isn't it?
Can ChatGPT transform cardiac surgery and heart transplantation? Question mark.
Oh, very dramatic. So before we get ahead of ourselves and start picturing, robot surgeons running around, let's be clear that this review really focuses on how AI could help human surgeons in, different parts of cardiac care, not replacing them.
Right, exactly. It looks at 8 potential ways ChatGPT could be used.
8?
Yeah, ranging from preoperative planning to surgical assistance, even training and support for hospitals with limited resources.
Wow, 8 areas. That's pretty ambitious, right? It kind of reminds me of all the hype around robotic surgery a while back. Everyone thought robots would be doing surgery on their own by now.
Yeah, there were some pretty big expectations back then.
For sure.
And while robotic surgery has changed some things, it hasn't really lived up to, all the hype.
True. So I guess the question is, should we be looking at AI in cardiac surgery with, that same kind of cautious optimism?
I think that's a good approach. This review is really expert opinion, what we call level V evidence.
Okay.
So it's a great starting point for discussions and future research, but it's not like hard proof that ChatGPT is ready to, scrub in for surgery tomorrow.
All right, good point. So let's break down some of the specific things they talk about in the review. What about this preoperative planning thing? The authors suggest ChatGPT could look at patient data and actually make personalized surgical plans.
Yeah, that's an area where AI could be really helpful. AI is great at recognizing patterns and putting together tons of data. That could save surgeons so much time.
Makes sense.
Think about it. AI could go through a patient's whole medical history, their lab results, imaging studies, and find the most important info for the surgeon.
Streamline everything.
Right.
Okay. But they also mention ChatGPT maybe, mentoring less experienced surgeons during surgery. I mean, is AI going to be holding the scalpel anytime soon?
Not quite. The review emphasizes that AI should really help a surgeon make decisions, not replace them.
Okay.
Cardiac surgery is way more than just knowing the steps of a procedure. You have to be able to handle unexpected things and make really quick decisions based on years of experience. And that gut feeling you get, from actually doing it, that's not something AI can do, at least not yet.
Right. So maybe mentorship isn't the best word for it. Maybe it's more like, AI giving real-time advice during surgery, like a super advanced assistant.
Yeah, that's an interesting way to put it. And it actually leads to another application they talk about, intraoperative monitoring.
Oh, you mean having AI analyze data during the surgery itself to catch any potential problems?
Exactly. Imagine AI keeping an eye on vital signs, EKG readings, blood gas levels, all in real time. If it could tell the surgical team about even small changes that could mean a problem, that would be huge for preventing complications.
Sounds like a game changer. But wouldn't that be way too much information for the surgical team? How would they know which alerts from the AI are really important and which ones they can ignore?
That's a great question. And it brings up the whole black box problem.
Black box. That sounds kind of, sci-fi.
It is, in a way. It basically means that some AI algorithms are so complicated that even the people who created them don't fully understand how they work.
So if the AI says there might be an issue during surgery, how does the surgeon know if it's real or just a false alarm?
Yeah.
How much can they actually trust the AI's judgment?
Exactly. If it's not transparent, it makes you wonder how surgeons can really understand and act on the AI's advice, especially when it's a life or death situation. We need to know why the AI is making a certain suggestion.
Yeah, it's like the AI saying, trust me, I got this, but not explaining why. That's a lot to ask when someone's life is on the line.
You got it. Transparency and being able to explain things are so important when it comes to AI in healthcare. Surgeons need to know the reasoning behind the AI's suggestions so they can make good decisions.
So even though AI is great at analyzing things, human interpretation and decision-making are still super important.
Absolutely. We can't forget that even the most advanced AI is just a tool in the end. It's the surgeon's knowledge and ethical judgment that should guide how that tool is used. And, that brings up something really important that the review mentions. The need for really thorough testing before AI can be used in operating rooms. safely.
You mean making sure these AI applications are totally checked out before they're used on real patients?
Exactly. We can't just assume that because AI works well in a lab setting, it'll be just as good in surgery.
Yeah, surgery can be pretty unpredictable. So what kind of testing would we need to do to make sure it's safe for patients and that AI is actually making things better?
We need those big clinical trials, the ones that compare AI-assisted surgery to the way things are done now. And these trials should be looking at whether AI actually leads to better outcomes for patients. That's the big question.
And wouldn't those trials need to be done in different kinds of hospitals and with different types of patients? What works in a huge teaching hospital might not work in a smaller community hospital. Right?
Absolutely. And that brings up another thing we need to think about: accessibility. Could using AI in cardiac surgery actually make the gap between well-funded hospitals and those with fewer resources even bigger?
It's a scary thought that some hospitals could afford this technology and others couldn't. It'd be like having a two-tiered system where some patients get the latest and greatest, but others are left behind.
It's a real concern. And honestly, it's something the review doesn't really go into enough. If we don't think carefully about how we introduce AI, we could end up making existing healthcare disparities even worse.
So it's not just about the technical stuff. There are these big social and ethical questions, too.
Definitely. We have to consider those right from the start, not just as an afterthought.
Okay, so we've talked about the need for really good testing and making sure everyone has access. What are some other big takeaways from this review?
Well, the review focuses on the potential good things about AI in cardiac surgery. But, it's important to acknowledge that there are potential risks and challenges, too.
Like what? Give us the lowdown on what could go wrong.
One thing that worries people is the possibility of the AI making mistakes. No system is perfect. There's always a chance an algorithm could mess up. And in surgery, even a small error can be a huge deal.
It's a bit unnerving to think about. So even with all the testing, there's no guarantee that AI will always make the right call.
That's right. And then there's the whole data privacy thing. AI systems need tons of patient data to learn and make predictions. We have to make sure that data is kept safe and used responsibly so people's privacy isn't violated.
We wouldn't want sensitive medical information getting into the wrong hands.
Absolutely. And one last thing to consider is how AI could affect surgeons' autonomy and decision-making. If surgeons start relying too much on AI, will they lose some of their critical thinking skills or be less likely to question the AI's advice?
That's an interesting point. It makes you wonder about the balance of power between human expertise and AI in the operating room.
It does, and it's something we need to talk about as AI becomes more common in surgery.
So this review is really just the beginning of a much bigger conversation about AI in cardiac surgery.
I think that's a good way to put it. It highlights all the exciting possibilities, but also all the complex challenges we'll face.
Let's do a quick recap of what we've talked about so far. The review looks at 8 ways ChatGPT could be used in cardiac surgery. Things like pre-op planning, helping during surgery, and training. AI seems really good at analyzing data and recognizing patterns, which can be hugely helpful for surgeons. But we also talked about some important concerns, like the need for rigorous testing, the chance of errors, keeping patient data private, and how AI could affect surgeons' decision-making.
That's a great summary. And I think it's worth repeating that while AI could completely change cardiac surgery, it's not a magic bullet. It's a tool, and we have to use it carefully, responsibly, and ethically.
Carefully, responsibly, and ethically. Those are definitely words to remember as we move into this new world of AI and healthcare. Welcome back, Deep Divers. We're jumping into the last part of our exploration of AI in cardiac surgery. And we're not alone on this one. We actually got some really interesting questions from our listeners that we want to tackle today.
Yeah, you guys sent in some great questions after the last episode. We picked a few that we thought really get to the heart of this whole AI thing.
So let's start with this one from Dr. Sarah Jones, a cardiothoracic fellow in Boston. She asks, with all this talk about AI, are we basically setting ourselves up for a future where surgeons are replaced by robots?
That's a question a lot of people have, especially with how, movies and TV shows portray AI.
It's like every sci-fi movie has robots taking over, right? So are we really headed for a world where robots are doing heart transplants on their own anytime soon?
While Hollywood loves that idea, the reality is a lot more complicated. I think the future of cardiac surgery is more about collaboration, not replacement.
So it's not about robots kicking surgeons out of the operating room,
Yeah.
but more about finding ways for AI to make human surgeons even better. That's got to be reassuring for both surgeons and patients.
Definitely. Qualities like compassion and intuition, being able to adapt on the fly, those are so important for good surgical care. And those are things that are uniquely human. AI, at least not the AI we have now, can't really do that.
That makes sense. It's more like a partnership where the surgeon brings their expertise and experience, and AI adds its ability to process a ton of information and help with decision-making.
Exactly. It's like having the super specialized assistant in the operating room working right alongside the surgeon to get the best possible outcome for the patient.
Okay, our next question is from David Chen, a med student who's curious about how AI could change surgical training. He asks, will AI make training easier or harder for surgeons?
That's a great question, David, and I think the answer is probably a little bit of both. AI could both make things easier and more challenging for trainees.
Both. How so?
Well, on the one hand, AI could be amazing for creating training tools. Imagine AI-powered simulations that let trainees practice really difficult procedures in a safe environment where no real patients are involved.
It's like a flight simulator, but for surgeons.
Exactly. And these AI simulations could give instant feedback, helping trainees figure out what they need to work on. That could totally change how we teach and learn surgical skills.
So that part sounds like it could make training easier. But you said it could also make it harder. Why is that?
As AI becomes more common in surgery, surgeons will need to learn new skills to work well with these systems.
So surgeons of the future will need to know how to understand the AI's suggestions, see where it might be wrong, and not just blindly do whatever the machine says.
Exactly. They'll basically need to be experts in both surgery and AI, which adds a whole new level of complexity to training. It's like adding a whole new subject to med school.
That's a huge shift in how we think about surgery. It shows that AI isn't just a technology thing, it's a cultural shift that's going to change how medicine is practiced and taught.
For sure. And this leads to our last question for today. Maria Rodriguez wants to know, what are the biggest challenges we need to figure out as AI becomes more widespread in healthcare?
That's a big one, isn't it? There are so many ethical and logistical things to consider.
We really need to be careful about how we bring AI into healthcare so that it benefits everyone. If only certain hospitals or certain patients can get AI-assisted surgery, we could end up making existing healthcare disparities even worse.
Yeah, making sure everyone has equal access is a big concern. We have to make sure everyone who needs these technologies can get them, no matter their income or where they live.
That's crucial. And we can't forget that AI is a tool, not a replacement for human judgment. Surgeons need to be trained to use AI the right way, ethically, and always putting their patients first.
It sounds like bringing AI into healthcare is going to take a lot of thought, collaboration, and open discussion. But the potential to improve things is pretty exciting.
I agree. If we go into this new world of AI with fairness, transparency, and patients' well-being as our top priorities, I think we can use its power to make healthcare better for everyone.
Well, that wraps up our deep dive into AI and cardiac surgery. We've gone over a lot today, from the potential benefits to the ethical things we need to think about as this field keeps changing so fast.
It's been a really interesting conversation, and I hope everyone listening found it helpful and got them thinking.
A big thank you to all our deep divers for being here and for sending in such thoughtful questions. We want you to keep those questions coming as AI keeps evolving and changing the world around us.
And remember, even in this age of AI, that human touch is still so important in medicine.
Love Suture This. Follow, share, and like. Until next time, stay curious, keep exploring, and we'll catch you on our next deep dive.